Okay, picking up with schizophrenia, and then we'll get into personality disorders. Schizophrenia is really a disease of the brain, and it's exhibited by the symptoms of the mind. We see a lot of brain abnormalities with this disorder, such as dopamine overactivity. Schizophrenic patients have much higher levels of dopamine, D4 receptors in the brain, and so really it's treated by limiting those dopamine receptors within the brain. And if you recall, dopamine is a neurotransmitter, so it's really limiting that neurotransmitter activity. There's a large genetic component to schizophrenia. Genes are a major factor in the development of this disease within a family. So lots of twin and adoption studies providing strong evidence linking it to genes. The highest risk for developing schizophrenia, as you can see, is if you have a blood relative with the disorder, highest in identical twins. The rate of development of the disease is only 50% for identical twins, but that still suggests that 50% of the disease comes from the environment. So some folks have proposed that the stress vulnerability model, kind of like the diathesis stress model, is a factor here. People with certain genetic markers, quote unquote, for the disease have a physical vulnerability to the disorder, but won't develop schizophrenia unless they're exposed to something environmentally or emotionally taxing, a stressful event at a critical time, like puberty or like launching into early adulthood. It appears that during those times of stress, in the early stages of the disease, there's something about the immune system that's activated and secretes large amounts of an inflammation fighting substance, which is what indicates that a possible infection has occurred. And that can lead to the possibility in the future that schizophrenia may one day be treatable, perhaps with anti-inflammatory meds. That's at least one thing that scientists are looking into, neuroscientists. We see that the brain is structurally different in people with schizophrenia. If you look at brain scans, you see abnormal activity happening in the frontal cortex, the thalamus, and the amygdala. Remember what each of these is responsible for, right? So the amygdala is like fear response, kind of like the fear center, very emotion center of the brain. The thalamus deals with very basic life-saving activity, controlled thought, eating behavior. The frontal cortex is, our judgment, planning, decision making. So schizophrenia and its positive symptoms and negative symptoms very much so play off of these brain areas. And so that's one thing that scientists look at when studying the schizophrenic is what's going on in those different areas. We also know that we talked about it's associated with lower dopamine activity. And this might be in part due to problems functioning in the frontal lobe. We see decreased blood flow and enlarged ventricles in people with schizophrenic brain. So this little butterfly looking thing, see how it's really swollen and big? It shouldn't be like that. That indicates enlarged ventricles. So there's something, their ventricles are more fluid filled when they shouldn't be. And so it has to do with blood flow to the brain. So this is good to know because these are all methods in which scientists are figuring out how to treat schizophrenia, how to reduce some of these abnormalities. So one therapy that works well is cognitive behavioral therapy, and it's usually used in tandem with antipsychotics. So the basic premise of cognitive behavioral therapy is attacking the beliefs, the expectations, and the different cognitive assessments that the person would be making of themselves or of the world or their personal problems at the time, really how the person perceives themselves and perceives others, how they approach problems, and how ultimately successful the person is being in coping with the world and achieving their goals. Schizophrenia results in distorted perceptions of the world. The person is not seeing the world through the right lens, right? And it includes their own views of themselves too. Very disordered, disorganized thinking. So it seems reasonable that a cognitive treatment works best. It's going to be helpful in treating schizophrenia. Assuming that medication is also employed, because the medication's got to work to alleviate the psychotic thought processes that then are going to interfere with any kind of psychotherapeutic interventions the person's attempting in therapy. So the outlook for recovery for someone with negative symptoms is not as good as someone with positive symptoms. So someone who has catatonic schizophrenia is not good. It's just not known how to treat it very effectively. A person who has flat affect, all of those negative signs and symptomology are not treated as good as somebody that has positive symptoms, like the hallucinations, the delusions. Those are treated very well, actually, with dopamine suppressing drugs. The only problem is that dopamine suppressing drugs over the life course have their own side effects that can be almost sometimes just as damaging. A person that's taking dopamine suppressing drugs can end up with tardive dyskinesia, which is basically the opposite of schizophrenia. It's slow motor movement, it's slow thought. You're thinking about moving your leg, but it takes you a really long time to move that leg. Whereas in the normal world, that wouldn't be. So, there can be tics, nervous tics in speech and behavior that can result. So obviously, the goal is to have the cognitive behavior therapy work to reduce symptoms as much as possible in the person, so they don't have to rely as much on the antipsychotics. But this is hard to do. It requires a lot of cognitive restraint in most people deciding what to believe and what not to believe within their own mind. So I encourage you to watch some videos of schizophrenic patients. I posted a couple on the website, but look up John Nash. He's the man who they made the movie out of, called A Beautiful Mind. Beautiful Mind is with Russell Crowe. He plays the life of John Nash, who was a mathematician, brilliant, genius, won the Nobel Prize in economics for his theories in game theory. But he was plagued with schizophrenia. He finally beat it on his own accord, really, after years and years and years of therapy and being in an insane asylum that didn't do anything for him. He just chose to not give in to the thoughts he was having. So it was a very controlled process of how he beat it. Okay, we're going to start with personality disorders, see if we can finish up in this lecture burst. Personality disorders are characterized by an inflexible and enduring behavior pattern that impairs the person's social functioning. The disorder doesn't merely have just an effect on one aspect of the person's life, but affects everything about their life adjustment. So the disorder is really the personality itself, not just one aspect of it. A lot of people with a personality disorder are very rigid. They have a very maladaptive pattern of behaving and ways of relating to other people. They can be very rigid or unable to adapt to the social demands of various life changes, which makes it difficult for someone with personality disorder to fit in with others and have normal relationships. They're usually full of anxiety, depression, delusions of various sorts. They cluster into different types depending upon what the predominant features are. So we have odd or eccentric personality disorders. Those would be your paranoid, schizoid, schizotypal, look a little like schizophrenia, but not quite, because again, these are enduring patterns over the life course. Cluster B would be your antisocial, borderline, histrionic, narcissistic personality disorders. And the book talks more specifically about each one. I'm not going to get into those here. And then cluster C would be your avoidant, dependent, and obsessive compulsive personality disorder. Some of the more popular examples would be Angelina Jolie's character in Girl Interrupted. She's a very borderline personality. And then Ted Bundy, of course, antisocial. And you see borderline hits more women, antisocial hits more men. This is inappropriate emotions, very moody, non-trusting, suicidal. Usually uses a lot of drugs, very overt sexuality, rapidly shifting moods, kind of stalker-like behavior, codependent, very needy. That's borderline. And then antisocial is very suave, manipulative, very fake, impulsive, again, high-risk behavior too. So take a look at the videos I posted of both borderline and antisocial. You'll get a good idea of what those individuals are like from watching those videos. Okay, usually hits people very young, teen years into early 20s. Usually it's found because the person's committed a crime or gotten in trouble with the law. Lower levels of stress hormones are found in people with antisocial personality disorder. So usually what causes a lot of stress for one person seems not to for those with antisocial personality disorder in particular. They care less about getting caught. And that's the anxiety that often keeps people from committing awful acts. It's like, I don't want to get caught. I don't want to get in trouble. But these people don't care if they get caught. They don't care if they get in trouble. So that fear doesn't exist for them. So they're much more willing to do, the unthinkable. PET scans show differences with those with antisocial personality disorder. The frontal lobes in particular, planning and forethought and thinking. And we see somebody very much absent, right? The yellow, the lack of the yellow here, which you see all here, means they're not caring. They're not having all this activity like they should be having when they're about to do something wrong. The normal person, they're about to do something wrong. Stress hormones go to work. And it's like, oh no, and the cognitions, and it gets going. And you don't see that happening in someone with antisocial personality disorder. Other correlates could be childhood abuse and neglect, having a lot of disturbances in family relationships, weird family relationships, weird family dynamics, parental relationships that are not okay, that are not healthy, overly strict parenting or overprotectiveness, rejection by parents. And again, authoritarian parenting does a lot of harm here too. Treatment is usually CBT, cognitive behavioral therapy, psychodynamic therapy. Medication can help, various medications like antidepressants, mood stabilizers, anti-anxiety medication, antipsychotics like lithium, any of those. And it might be a combination because, again, you're treating the symptoms of personality disorder. The problem is that most people with personality disorder don't believe they have a problem. So they're not usually willing to get help. They don't want help. They think that they're fine. They might think that everybody else has the problem. So they're not always good candidates. They can be extremely withdrawn or suffer from other psychotic disorders that are comorbid that prevent them from getting the help that they need. So here's one of the readings. This is the Learning to be Depressed. It has the old Hawk number on it, but that's a good one to look at if you want to know more about learned helplessness and its role in depression. And then this one, Relaxing Your Fears Away, deals with systematic desensitization and how it's used to treat anxiety disorders. So definitely recommend looking those up. But also go back and take a look at some of the videos I posted on personality disorders so you can get a good sense of that. Okay, thanks everyone.